few days ago, a woman entered a Lloyd's pharmacy in Brighton, in the south of England, attempting to obtain emergency contraception. She had a legitimate prescription and had pre-ordered and prepaid for the medication online. On arrival, the pharmacist refused to fulfill the prescription for religious reasons. She was instructed to come back the next day or to go to another pharmacy 10 miles away. It was a Sunday, so most were closed, and emergency contraception or emergency hormonal contraception, EHC, becomes less effective the longer you leave it. This isn't the first time this has happened, and in fact seems rife. Can a pharmacist legally refuse to provide EHC in the UK? It seems so. This article from the Pharmaceutical Journal is suitably vague and leaves a lot of scope for abuse. Section 16. Pharmacists who choose not to supply EHC. 16.1. Pharmacists who choose not to supply EHC on the grounds of moral or religious beliefs should treat the matter sensitively and advise on an appropriate local source of supply available within the time period for EHC to be effective, i.e. within 72 hours of unprotected sex. So, sensitively, well, reports of multiple interactions imply that customers are experiencing anything but. From pharmacists refusing to even engage with the customer, deferring that to other staff, and refusing to provide reasons for the refusal. The simple act of being refused EHC can be humiliating and distressing for the customer, regardless of the reasons given. As for advising on a local source of supply, sometimes pharmacists will refuse to do even this. Even so, what's to stop the customer being refused again? The pharmacist could be a locum who also had religious values. What if it's a Sunday and there are few pharmacies open? What if the pharmacy is several miles away and the customer doesn't have private transport? And why is any of this acceptable? In an online poll conducted in 2013, the Pharmaceutical Journal found that the results indicated an almost 50-50 split in favour of making it obligatory for pharmacists to supply EHC. I find that shocking. Comments included those who saw it in terms of secularism, such as Jonathan Cook, Honorary Professor at the School of Pharmacy and Pharmaceutical Sciences at the University of Manchester, agreed, adding, if anyone considers this to be a problem for them, then they should choose another career. Health is a secular matter, absolutely. But not everyone agreed with him. Duncan Livingstone, a hospital pharmacist, who said, I personally have no difficulty with the supply of EHC. I do, however, accept and respect the moral or religious views of others, and unlike Jonathan Cook, do not see the professional world in purely black and white, right or wrong. Or pharmacy student Abdullah Mahmood, I feel to even consider removing the conscience clause is a huge violation of a healthcare professional's rights, as well as discriminating against people based on their religious and moral beliefs, which is clearly unacceptable. Unfortunately, it seems that some religious pharmacists clearly have odd definitions of sensitive. Take the case of Piotr Mikolaj Makrowitz, probably massacred that, who in 2012 subjected a patient to a distressing lecture on the ethics, read evils, of EHC. On application for the EHC, he took the patient to a consultation room to discuss the supply, but kept on sighing and seemed very uncomfortable with the situation. Mr. Makrowitz admitted to telling the patient that EHC was against his faith and that it amounted to abortion and that it was how the Pope would see it. He denied saying that the act would be on the conscience of the patient. Mr. Makrowitz also refused to redirect patients to a more willing supplier, which forms part of the guidance for EHC. As a consequence, the General Pharmaceutical Council banned Mr. Makrowitz in 2015 for his stance. Is refusing service a right or a privilege? Well, I'd argue that if it allows you to do what others cannot do, then it's a privilege, not a right. Would it be acceptable for me to refuse service for political reasons? Maybe the customer holds views I find abhorrent. If someone wearing a MAGA hat walked into a pharmacy in the US and was served by a left-leaning pharmacist, would it be okay for them to refuse service? Look, by all means, you have your beliefs, but please, keep them out of the workplace.